I would summarize this ASCO for GU tumors as not as updates of data that we're already seeing that from important relevant studies, but a few of them are able to change practice. Perhaps one of the biggest ones would be the trial that was presented today, addressing or trying to answer the question whether or not there's a role for salvage immunotherapy for patients with advanced renal cell carcinoma, kidney cancer, progressing on frontline immunotherapy. So that trial is a negative trial, and it's a Lancet paper, and because being a flat negative trial, it shows us, or at least is the first randomized phase 3 trial to suggest that might not be a role for salvage checkpoint inhibitor for those patients. So we do not have any data today to support the use of immunotherapy in the salvage setting. That is potentially practice changing, since a lot of us in the community, in our practices, are considering doing that. So I do think there's practice changing. There's another important. There's a number of other trials with important data, in my opinion. I'm thinking in prostate, I think it was relevant to see data from PIS1 showing that offering radiation therapy to the primary tumor helps us, with minimizing local problems that patients with a primary prostate mass can develop in the context of advanced disease. So I think that's relevant information. I think it was very interesting data regarding, still in prostate cancer, regarding PARP inhibitors with or along with radioligand therapy. I think that's the first of many we'll see. I think there's definitely a concept of exploring potential synergistic opportunities there with the PARP inhibitor and radioligand therapy. That's another study. And maybe in bladder cancer, I would perhaps highlight the trial where we've seen that a target therapy against EGFR was superior to chemotherapy, which has been the standard of care. A platinum-based chemo has been the standard of care for patients with advanced urothelial carcinoma. And so that highlights the role of genetic testing for patients who present with metastatic urothelial carcinoma. Again, I'm not quite sure how that's going to play out since there's very compelling data for a different combo with immunotherapy in front line. However, I think it's important data to know that it reminds us of the role of genetic testing for patients with advanced disease, and actually we can find target alterations, and we can actually with treatment implications. So anyway, those are some of the highlights. There's very important data out there, but I would highlight these studies as probably some of the studies I'll talk tomorrow in clinic with my patients.